For a conversation on medical marijuana, please welcome Chinazo Cunningham, a professor at Montefiore Medical Center's Albert Einstein School of Medicine, Andrea Drummer, the CEO, co-founder, and chef of Elevation VIP Cooperative, and Yasmin Hurd, director of Mount Sinai's Addiction Institute. Here to lead the discussion, welcome back, the Atlantic's James Hamblin.
Thank you all for joining us. So we're going to be talking about cannabis. And lest this seem like a frivolous subject, around 72,000 Americans last year died as a result of opioid overdoses. And a lot of that happened due to heroin and narcotics obtained on the streets, but a lot of that started with prescriptions legitimately written from doctors. So we need alternative approaches to managing pain, and especially when it comes to cancer. So we're grateful to be joined by experts in the science of medical treatment as well as the culture of cannabis and how that is changing the way we think about pain management. So I want to start with you, Dr. Cunningham. Maybe could you tell us a little bit about the role that marijuana is currently playing in managing pain in cancer?
Absolutely. So there's been a huge amount of effort at many levels to reduce opioid prescribing because we know about all the harms that we see today. And so there are many recommendations to think about non-opioid treatment or non-medication treatment. But we really don't have that much to offer. And so one of the non-opioid medications is cannabis. So what we know is that in 33 states that medical cannabis is legal. And here in New York, it's been legal for about almost 2 years. So clearly, American people have voted to move forward with medical cannabis, and so we see this in our clinical practice, patients asking for it, or medical providers considering this as one form of treatment instead of opioids. Some of the challenges that we have, however, is that not everybody has access to it. And so every state has different sort of laws around this, and because it's of the limitations at the federal government, insurance does not cover medical cannabis, and this is one big barrier to actually accessing this as a treatment.
And doctors know and are willing to involve this as part of therapy, or are people still mostly using opioids?
Right, so this is a huge question. So when I went to medical school, I never had any education and training on cannabis, and I would say that that's still the case in most of the medical schools around this country. A lot of medical providers want data. They want to know what the research shows. What should I do? What should I prescribe, or what should I recommend for my patients? And the problem is that the research is really lacking. So even though most of the United States has legalized medical cannabis, we still have so many questions about what's the right thing to do. And again, this comes back to how the federal government handles cannabis, which really restricts it and makes it much more illegal than in the other states. And that also prevents us from doing the kinds of research that we need to do in order to know the answers to either guide clinical care and guide our policies.
And so we're fortunate to be joined by Dr. Hurd, who's one of the people who is licensed to research medical marijuana. Mm-hmm. I wonder if you could tell us about what we do know right now about how effective it can be and what role it should ideally play in among the options that are out there.
I can say that we're still in the early stages of research in understanding how medical marijuana can be used for not only the opioid epidemic, but also in pain. So for opioids, we have done a lot of studies now, and others have replicated a number of our findings that, for example, a specific cannabinoid, cannabidiol, improves or decreases craving, decreases anxiety that you see in people with opioid use disorders. That usually accounts for their craving and drug seeking and the relapse. It's critical that people know that when we talk about medical marijuana, it's a very complex plant. it has over 140 cannabinoids, one of them being THC, which is the psychoactive component that is associated with the intoxication, the high. And actually, that's the cannabinoid that has been studied the most in regard to pain, and even in terms of aspects of cancer. Cannabidiol, or CBD, because that is what we have been studying for anxiety, people have been studying for depression. It's also been studied with pain, but it's often in combination with THC. So it's important to realize that we don't have a lot of data as yet as to what particular doses even of the specific cannabinoids or the combinations of the cannabinoid or the plant, the full plant itself in terms of, as I said, the dose, the type of treatment regimen that's needed once, twice daily or whatever. So it's still in the early phases of research, but there is data that shows that there is a potential for it for being effective in certain conditions related to opioid use disorder and aspects of pain and aspects of anxiety that's important for people with cancers as well.
So I'm framing this too narrowly and talking just about pain because there are a lot of aspects of dealing with cancer that could be addressed potentially by this. So what, for a prescribing doctor, I mean, what is the level of evidence that's needed to actually incorporate this more into clinical practice? Because it's not like we're going to do nothing or give people cannabis products. It's kind of, we give this very dangerous opiates or cannabis or both.
With that said, and Dr. Cunningham, I mean, there's a lot more, even though opiates are very dangerous, physicians know the dosages to use and to prescribe, and for specific pain indications, we don't have that level of knowledge, physicians and scientists, in terms of what dose of marijuana would be effective for what particular pain. So we know that the cannabinoids, as I said, there are multiple cannabinoids, and there are different types of pain. So neuropathic pain, inflammatory pain, there are many different types of pains that it seems that different cannabinoids may be more effective for. So clinicians will need clinical trials that show the dose range for specific pain indications or for specific disorders that they can then say to their patients that they're confident that within this dose range, these are the side effects to expect. These are, this is how long it could last. And I think that definitely is not there. So until the FDA has also made it challenging for us to do research as well, because marijuana is still considered a Schedule I drug, which means that it's considered not to have any medicinal value and is a substance of abuse. Because of that, it's very difficult for people to conduct clinical trials because you need the bureaucracy of it is challenging, and with the governmental regulations of carrying out such trials. So we need more people to carry clinical trials to be able to inform physicians and patients as to which cannabinoids may be most effective.
It sounds like there's a sort of a chicken and egg problem. We don't have the research to show exactly that this is the therapeutic drug we hope it is because we can't do the research because it's not thought of as a therapeutic drug.
Yes. And it's changing. I mean, for epilepsy, kids with Dravet syndrome, Epidiolex was just approved by the FDA, and now it was reclassified as a Schedule V drug and available in all 50 states. So that will make a huge difference for patients with kids with epilepsy, and that I think will help impact the FDA. Hopefully, we know that there are discussions to change the scheduling of marijuana.
I also just want to jump in and give an example of where some of these issues are. Is there are dispensaries that give starter packs. So, different dosing of the THC and the CBD because we don't know. We don't know how this person with this pain condition or level of anxiety is going to respond. And so that's kind of crazy if you think about it, that they're going to walk out with 3 different formulations and it's like, try this, then try that, then try that. I mean, we don't really do that with other medications because we know the risks and benefits because it's gone through a rigorous research process to understand that.
Right.
If I may ask,
Speaking of cultural,
what are some of the
perceptions of this.
obstacles that you found in conducting trials?
So, I mean, I have a license, but most people who are trying to study and carry clinical trials don't have a license. It's very cumbersome. And the challenge is being able to study marijuana from, for example, different companies, because the companies who are allowed to provide the product for research, they have to themselves go through a whole governmental regulations and applications. And to date, the FDA has not approved the majority of companies who have applied to be able to provide products for research.
Right.
So that becomes a huge challenge. So then we're all studying products from one or two companies, which is not correct. There are a number of companies developing really great products and different formulations. So it's another thing. You know, smoking will never be a medically approved route of administration for marijuana. So when people think that, you know, they can smoke and it's fine, because you want to know what amount you're getting. When you smoke, the bioavailability is it varies a lot. So there are companies working on different devices to improve the bioavailability so that it is, you know what, again, the amount of the drug you take is the amount that's going into your bloodstream that's going to impact on the particular symptoms that you're trying to alleviate.
Speaking of different methods of administration, could you tell us about your work, Andrea, with food?
Well,
and your
I started a second career as a chef. My first career extensively being a nonprofit. I worked a lot here in New York with the Coalition for the Homeless. I've worked with Planned Parenthood, the Urban League of Broward County in South Florida. And I was a part of the different conversation, which is cannabis is a gateway drug. And so a lot of my work entailed that propaganda. And once I moved to New York and kind of started doing my research and came to understand it in a different capacity, and wanting to change careers, I did that as a chef. And what happened is, as I was in the kitchen, again, this is second career, I'm an older woman of a particular age. So I was, you know, experiencing different ailments and the like. And they were wanting to prescribe opioids and Percocets and all of these things. And I refused. And what I found is that as I wanted to explore options, that was not okay. I could take opioids all day, but I could not try cannabis or CBD. So I did us all a favor and I quit. I was working with a prestigious hotel chain that I had opened in downtown Los Angeles. Do the research, you'll find their name. So I just combined the two. And then I learned that what happens is your body, of course, metabolizes cannabis CBD differently when you ingest versus smoking. So it just kind of made sense to pair the two together. And so what I've been doing is going around not only cooking for people, but also advocating for the plant.
And these are CBD-infused foods.
Well, I do both, so THC as well as CBD. And what I've been able to also do is work with in fact, there's a small chain here, a boutique hotel, the James Nomad, that I was able to create and curate a CBD program for them.
And how do you think that's changing the cultural perception of the validity of using cannabis as a therapy?
Well, again, educating the masses, the general public, that, you know, it's different as you ingest food, and also everybody eats, right? So it makes it more palatable, for lack of a better term. And that, in and of itself, helps to change the perception, you know. When I started out, I was secreted for about a year before I told my parents, who are devout Christians and were completely against anything of this thing. But they were welcoming, to the point now that my mother is accepting and taking CBD products.
It sounds like there are two narratives kind of happening at the same time, and it's now easier to get CBD-infused products than ever was before. You can't go down my block in Brooklyn without passing like 5 sandwich boards begging you to come in and get the skincare products or whatever. And then at the same time, it's still hard to be a doctor and have a way to prescribe this in a regimented way. What is the proper, is it inevitable that we just go the route of deregulation and sort of alternative individualistic uses, or can we have also a highly scientific medicinal approach?
I mean, as a doctor, I would choose the latter, right? I mean, we really talk about the science behind all of what we do, and we really want to have a nuanced way of thinking about what we need to give the individual patient in front of us to get the best health outcomes, right? And we need science in order to do that. And, some people don't have the time to try all of these different products to finally figure out what works for them, and then in the meantime be in terrible agony and terrible suffering. I mean, that is one thing we can do. Maybe we can't cure cancer, but we can certainly address pain and help people be more comfortable in their lives. And so we have the tools. It's just right now that there's a huge barrier in front of us, which is really the way that the federal government has categorized cannabis. But what's shocking is that the rest of the country, the American people have clearly voted differently than the way that the federal government is handling this. And so that's really where there's a tremendous amount of challenge. And it's not just the research, but it's also the access, because no insurance companies in this country cover medical marijuana because of the federal categorization. And so it really does create a huge amount of barriers for everybody.
Yeah, and I can also add, I mean, our country decided to go down two paths, and I think this is a huge problem. When we said about voting on medical marijuana, it's the first time in our history practically that we're saying that people who are not scientists and not clinicians can say that this thing is medicinal without any data whatsoever. So what the evidence-based medical society that the U.S. have been, grounded on, that clinical trials, research, then decides, the FDA decides, okay, this can be moved for clinical use. We integrated recreational marijuana use and medical marijuana use. So now the terms have gotten intertwined. So people who are against recreational use think that medical marijuana is recreational, that it's just a backdoor. And so we also fight that stigma in trying to carry out clinical trials, because they're just thinking we're just trying to do it to give people a way of getting high, and it's not. There are, and it's really, and I'm emphasizing this a lot, there are a lot of companies out there who are developing different cannabinoids, cannabidiol, and there are different qualities. So it always shocks me that people are willing to consume drugs, for lack of, from places they have no clue about. So it's really important. Many people are making money today, but you have to know that when you go into certain places and buy these products, they don't even contain the CBD that they say they're supposed to.
Right.
They also have adulterants, some of them even have pesticides. And we're saying these are organic and they're good for you. So the reason that there is a medical path is that once something gets into the pharmacy, my dream is that medical marijuana is in the pharmacy, that you can get prescribed by your physician and pick up at the pharmacy like any other medication. There shouldn't be a stigma that you have to go into a dispensary, hide, or into your local, street there in Brooklyn. It is very different. And I really hope that people understand the difference between medical and recreational use. Recreational use, the country could have voted on, but medical use, it should have been through evidence-based research. And the food looks delicious, by the way, so I will be high. But when you consume the foods, when you eat them, the amount of the cannabinoids, 80% of that gets degraded. So we don't know the health benefit of drinking, eating a number of the cannabinoids unless you test it. And I think that there's nothing wrong with eating great food, even if the majority of the medication might be degraded. because it's not going to, at least CBD doesn't have a negative effect, if anything, so I'm fine with that, but I just want people to know.
Yeah.
So I asked about the challenges because I know in California we've had legalization for upward 22 years, and I know of entities that are doing trials currently, and one of the problems that they are having is that as opposed to having access to great product grown in California, they're having to resource out to places where the product isn't as good, is not as CBD rich. They don't know the product, which is creating a challenge as well. So,
Yeah.
Right, we're also conducting a couple of trials at Montefiore and Einstein in the Bronx, and we have to figure out a workaround, a complete workaround because of all of the barriers, and that's what it is. So how can I figure out how to use the products that are available in New York, but not use the federal dollars because that's illegal, and it just creates this huge puzzle, and that's what we spend all of our time doing instead of the actual research and work.
Yeah.
Right.
So the market incentives are then for people to sell it as a supplement product
Exactly.
and promise almost anything they want and start making money right
Yeah.
away.
and the
yeah.
same with food. We want to be able to access the greater properties of it and explore what foods works best. But the law as it stands and all of the transitioning that we're going through, it's a challenge because we don't have on-site consumption, and those that are trying to regulate it have no understanding of the culinary world. So we need culinary scientists and people that are familiar with culinary and how food responds to different CBD and THC products. But again, we're having challenges even trying to get to that regulation.
Exactly.
Lots of challenges, lots of opportunity. I'm
lots of
excited about it. Thank
opportunity.
you all
Thank you.
so much for coming. Please give a round of applause.
Thanks.